So it's my pleasure today to interview Jennifer. She's a nurse. And Jennifer, introduce yourself and tell in your words how a nurse got here. What was your journey?
Well, my name is Jennifer Trouwerbach. I work as a headache nurse in the Leiden University Medical Center in the Netherlands. And my journey is, well, not typical, I think, for a headache nurse, because when I started my career, I never thought about the headache field. I was a nurse at the inpatient clinic for 22 years or something, like on the bedside. And I decided I needed a career change with, well, new starts, new adventures, challenges. And because I worked with Gisela for many years and I heard she was starting a headache center, I did not know anything about migraine because the department I was working, there were really severe neurologic, no, sorry. There were really severe patients with neurologic diseases. And so I had to start all over again as a nurse because I didn't know the migraine field or the headache field at all. So, and then I find out there was no training beside what I learned from Gisela and my other colleagues. And I thought, what do I need as a nurse? Because I need different education than neurologists. And of course, you have to know about headache disorders and medication. But I have a different rule. I'm a nurse, so I look at patients in another way because my rule is totally different. So I developed together with Gisela, like who am I, what do I think patient needs, and we developed that in years. So it's not just 2 weeks and you know everything. And from then on, I thought, well, what do I do with my knowledge? Because I know now so much, and not everybody is rich as I am to work with fantastic colleagues and have a lot of opportunities. Like, well, now I'm in Brazil, right? It's not a normal uh, um, thing to do for a nurse. I realized that, and I try to contribute in headache care.
Look, I'm looking in my viewpoint as a doctor. It's amazing how obvious is it to put a nurse in direct care of patients. You are historically much more close to patients than we doctors are. And in the headache field, we do need this closeness. We have to put the patient in the center of the care. And that's something that you do a lot of times since Florence Nightingale.
Yeah.
So
Well, I don't consider myself as a Florence Nightingale because I'm trying to empower patient and Florence Nightingale, which is really inspiring at that time. But she was doing a lot of, how do you say it, nurturing stuff, like getting. And I like to give the patients their own empower. So what I developed in the well, already I'm working in the headache field from 2008. So I try to empower patient, like, what's your journey with this headache disorder? What do you know? Because I was really surprised, or maybe, well, that's not even a strong word, but some people, they don't know anything about their migraine. And I think, gosh, how is that possible for now? Because there's internet, there is so much, but there's so much rubbish in the world.
Yep.
So patients, how can they pick up their own stuff? How can they find out what's real?
You drive
Yeah.
patients to a correct education.
Yeah.
Should we call it one of the pillars of your job? Is
Yeah, I
just
think so.
to
Yeah.
say patients where and how to get the most trustable information for them to know their disease.
Yes, and also what fits with a patient, because you have patients from all categories. Some patients don't want to know all about the disease, but how can I cope with it, with my little children, with my job, with if I if I do this, then I get a migraine, and then you have to tell them migraine is a brain disease. So it's not your fault that you get a migraine attack or whatever.
So you
As
try to reduce stigma too.
yeah. And I try to empower patients, but I think one of my biggest job in the International Forum of Headache Nurses is also to empower my colleagues, empower new nurses, try to find out where can you find out your where can you find your information? How I'm doing my job, and all nurses are doing well their own best job, but is there a best practice or what fits you? What's and even in a country, because not all the countries are the same. We're trying to develop in Europe, like in the Netherlands. When I started, there were a small group of headache nurses, and I thought, well, why find out all by ourselves what's the best practice? So we gather around the table, like with 8 nurses or something, and then 8 became 12, 15, 20, 60, whatever. So we have a big national network, and we try to get good information. So we ask colleagues like Gisela to talk for our headache nurses, and then we had topics like not only about the disease, but also like what's good practice.
Great.
And how can you try to figure out what your patient needs? And well, more important, how don't you lose yourself? Because headache patients, they know a lot of stuff they want, but how can you give best care and then still let the patients be empowered to their own body, to their own.
That's very interesting. Tell me a little bit more about this International Forum of Headache Nurses. If I am a nurse in whatever country in the world, how can I get in touch? How can I gain some knowledge from you? And tell me.
Yeah, our international forum is for free, so all the nurses can join us. We have a website from the International Forum of Headache Nurses, and you can find out our activities. Whenever we are trying to to have a new activity, we will put it on our website, and we give more information. If you join us, you will get an email like we're on the next conference where we have our speeches. So now we have done a lot of speeches in conferences, and we're trying to every time to find out something like what's nursing stuff to do and educate more. And in Europe, we have a lot of national groups. And now the national groups are also into the international forum. And we try to help countries to start their own national group also, like with our knowledge. What did we do and what can you do and how are you organizing it? And we try to go every 2 years to a country with the international forum, and then there's a local meeting and the international headache nurses will join them, and then we try to figure out a nice program for the country, and the country itself is in charge, and we help them to make nice workshops or get to
What a wonderful mission. And
yeah.
how far internationally have you gone already? How many countries are involved in this
Oh yeah.
huge project?
Yeah, I was thinking of that yesterday, but I could not find the figures. But we have a nurse from Japan, we have Australia, we have America, UK.
Brazilians?
No,
We need to
Brazilians.
gather some
We
Brazilians.
really have to find some. Well, if you know a Brazilian nurse, please give her my
By all
contacts.
means.
Yeah. So we're trying to reach out, but it's not always easy because we're nurses, and nurses, well, we're not poor, but we don't have a lot of sources to go to international meetings or whatever, because it's a lot of money for nurses. And the other aspect is that a lot of nurses are afraid to talk English. So sometimes they are really eager to join us, but they think it's really scary to.
I'm pretty much sure
Yeah.
there will be challenges, but
Yeah.
we should work together.
Yeah.
We should work together. If in the medical field, I think it's our I should say obligation for us to work interdisciplinary. Medical field for years in history is a very egocentric profession, and we don't work like that anymore. We need nurses, we need physical therapists, we need other specialties to work together. And in some fields, we do have this experience already. In the stroke field, for instance, it's amazing the advances that we have achieved working together with nurses. So in the headache field, you should do that too. I'm pretty much sure you're gonna accomplish with this mission.
Yeah, yeah. Well, I think it's really important to empower everybody, like your colleagues, your patients, and well, I always like to look like, what do I miss? What can we do? How can we reach out for more people? And yeah, that's I think part of my mission, like try to grow.
Wonderful. And any final words?
Yeah, well, that's a
What?
difficult one. Yeah, I hope we find some new nurses to try to be in the field together with a neurologist, because we do have a different approach, and I think it's nice to work together with a neurologist and a headache nurse to try the best for your patient, because we have a totally different approach, and together with a neurologist we can make it as good for a patient as it is.
Thank you very much. It was my pleasure and my honor to know all this work, and hope we all can push development of the headache care over and over better.
Yeah,
Thank you.
thank you.